So our hospitalized census continues to decline, slow but sure. We're between 20 and 30 at this point. It is in flux. However, a word of caution. We still see daily positive cases through our lab. We're still seeing at least admission every day, up to 3 and 4 on certain days, and we're still seeing some deaths. So in a sense, our experience is paralleling the national experience, which has showed a flattening or plateauing of cases even as hospitalizations and deaths have declined in recent weeks. Sort of to continue on this theme, why are hospitalizations dropping? Why do we see the steep decline? I think primarily it is our own behavior. The masking, social distancing, hand hygiene, and avoiding of those big indoor spaces, such as crowded indoor dining, theaters, etc., I think is very important in controlling the spread of this virus. The post-holiday, Thanksgiving, Christmas, New Year surge probably had a lot to do with those kind of gatherings. At this point, I think we have to keep our foot on the gas pedal on those basic practices. This virus is going to be with us. And in the months to come, it's going to be very important for us to continue basic infection control practices, as I just mentioned, as we vaccinate our population. I think the error that we can make is to open up too quickly before the population is vaccinated. So yes, we have to have caution. The virus has not gone away, and in fact, we're seeing some mutations that could pose challenges to our current vaccination policy and may be more transmissible and perhaps even more deadly in certain cases than the original strain of this virus. So caution, I think, is the word going forward. So I get asked a lot, when is this going to be over? And I think national experts, other pundits have suggested perhaps late summer, early fall. I do think, though, it really isn't useful for us to talk about when this is going to be over. We have to decide and focus on what we're going to do right now to decrease infections, decrease transmission, and increase vaccinations. We hope once we have this population, our population, at herd immunity, 70 to 80% vaccinated, we will see the incidence of this disease drop off substantially. We need to get there before we take our foot off the gas pedal.